Well, I've got arthritis in my hands, in my knees and in my ankles. I've got diabetes, I've got angina, and I've also got what they call a dry mouth syndrome, and I've got pernicious anemia. So I've got quite a few things. I went to my GP and she did tests and obviously diagnosed at first the pernicious anemia, and then I was diagnosed with diabetes, and they asked me would I like to go on an expert patient programme for a long-term illness. So I said yes, I would try it. So I came on the expert patient programme for 6 weeks, and I've never looked back since. It taught me, it gave me a lot of confidence to be able to deal with the problems that I've got. The people who was on the course, we all had different things wrong with us, and at the end of the 6 weeks I felt as though I could cope with anything. It told you how to, when you think that you can't do activities, just small things like small walks, going up and down the stairs if you've got stairs in the house, eating the right foods, taking your medication properly and not missing it. And them are the things that I learned, because sometimes I took the medication, if it was out I never bothered about it, but it made me learn the importance of taking medication and to change your lifestyle. Well, there was a lady there, she'd had it over 15 years, diabetes, and she couldn't believe it in the 2 weeks of being there, how she'd learnt how to change her lifestyle, and she thought the things she was doing was right. But she wasn't exercising, she wasn't taking her medication right. Sometimes she was holding medication and going back to it, and it's made her realise you cannot do that. You've got to take it at the right times and eat the right food. I did miss doses of the medication, and they explained to me that not taking the medication, all as it does is, in the long term, it makes your illness worse. And they said you must always make sure, that is the reason I went onto the Dorset box, because of the expert patient programme, because I used to just leave it and just pull the pills out and used to miss it all the time, but now I don't. And if I hadn't gone onto that programme and they hadn't have told me the importance of it, I'd probably be worse today and always at my doctor's surgery. I used to sit back a lot and not go to my doctors. I used to like suffer in silence, but when I went onto that programme, all the pain I was on because of me pernicious anemia, and also I was so tired, it made me care about myself more. And I went to the doctors, I got the right medication what I should have been on, and I was taking it. I still get tired, but nothing like till I went on the expert patient programme. It made me realise if you look after yourself and live a better lifestyle, you can do it. What we do now is we meet the people who was on the course, we meet up once a month and go to St Mary's Church in Reddish, and we like swap stories and talk, and people say if they've got problems, and you talk, we all talk in a group, and I feel as though it's really lifted my confidence. I've met people who I would never ever have met, and it's been absolutely fantastic. I never ever knew that there was courses like this. I can't thank highly enough of my GPs, from the receptionists, from the diabetic nurses. They're absolutely unbelievable the way it's run their practice. I was shocked at some of the people who was on the course where the GPs never even checked up on them. But my GP checks up all the time. When I'm due for me injection for the pernicious anemia, they ring me up, the receptionist, on the same day and say, don't forget Gladys, it's time for your appointment, so don't forget it. Well, I would say for other GPs who they're not sure what it's all about, if it'd be easier if you sent your patients who you think would benefit from these courses. It'd be a lot better, because they wouldn't have to be visiting you as much as they do now, and it'd build all the confidence up, mixing with all these other people who they'd have never have met before.